Assalamualaikum. Today we will discuss congenital cardiac malformation. First of all, we have to know what is congenital cardiac malformation. That means malformation occur in the heart and which is present from the birth. That refers to congenital, okay, which is present from the birth. Now, the classification of the congenital cardiac malformation, there are three subtypes. First one is according to the position, that is abnormal position of the heart. Then next one is the cyanotic cardiac heart disease, and the last one is the acyanotic cardiac defect. So, according to the abnormal position, there are two subdivision. First one is the dextrocardia, and second one is the ectopia cordis. So, first of all, we have to know what is dextrocardia. We know dextro means right. Okay, so if the heart is situated, the apex of the heart situated on the, we know normally the apex of the heart situated on the left side. If it is situated in the right side, here we can see now the apex of the heart situated on the left side. In the, we know in adult condition, left fifth intercostal space. If the apex of the heart situated in the right side, in the next picture, instead of the left side, that condition is known as the dextrocardia. And the second abnormal position of the heart is the ectopia cordis. This one, ectopia cordis. Ectopic, we know the word ectopic comes from abnormal position. Okay, ectopia cordis, when the heart comes out in the surface of the body wall due to defect in the sternum. That means if the two cartilaginous plate of the sternum fail to fuse in the midline, in that condition heart may comes out in the surface of the body. This is known as ectopia cordis. Next classification is acyanotic cardiac defect. So first of all, we have to know what is cyanosis. Cyanosis means bluish coloration of the skin, sclera and mucous membrane due to lack of oxygen saturated blood. Okay, so in acyanotic cardiac defect there is no change of color of the skin. Okay, it is remain normal. uh, what happened, the acyanotic cardiac defect is again subdivided into two groups, that is left to right shunt and without shunt. So first of all, we have to know what is shunt means the net flow of blood. Here the left to right shunt, that means the net flow of the blood is flow from the left side to the right side. And what are the what are the component of the left to right shunt? The first one is the ventricular septal defect, then atrial septal defect, and the last one is patent ductus arteriosus. So, what is ventricular septal defect? So, what is ventricular septal defect? We know in between two ventricle, right and left, there is a muscular part, and in the upper portion is membranous part. If the membranous part fail to fuse with the muscular part, there is a gap or defect. This is known as the interventricular septal defect. Next one is the interatrial septal defect. Okay, in between the right and left atrium there is a septum. If the septum primum and secundum fail to fuse and there remain the foramen ovale unable to close, fail to close, this is known as the interatrial septal defect, or the foramen ovale remain, this is also known as the patent foramen ovale. Next one is the patent ductus arteriosus. Here we know in the fetal circulation the pulmonary trunk divide, and at the site of dividation, that means in between the right and left pulmonary artery, there is a communication between the aorta and the pulmonary trunk. This communication is known as ductus arteriosus. After birth, this ductus arteriosus is closed. If it fail to close, this is known as patent ductus arteriosus. So here we know these are the classification of the acyanotic heart disease. So why they are acyanotic? We know in the right side there is deoxygenated blood comes from superior vena cava and inferior vena cava, and on the left side there is oxygen saturated blood from the four pulmonary vein. So here we know in the left side of the heart there is a more pressure. Due to more pressure on the left side, we know the blood goes from the higher pressure to the lower pressure. So here the shunt is from the left side to the right side, and in the left side there is oxygen saturated blood, and that oxygen saturated blood goes in the right side, and then it circulate throughout the body. So oxygen saturated blood circulate throughout the body, so there is no change of color of the skin sclera and mucous membrane. And in the ductus arteriosus, here there is a question may arise that the pulmonary trunk contain deoxygenated blood, so why patent ductus is under the acyanotic heart disease? Here the answer is, in the aorta there is more pressure, and as a result of more pressure in the aorta, the blood comes from the aorta to the pulmonary trunk, so the oxygen saturated blood goes into the body, so no change of the color of the skin sclera and mucous membrane. So this is under the classification of the acyanotic heart disease. Now, without shunt in acyanotic heart disease, there is various types of classification, that are the stenosis. So first of all, we have to know what is stenosis. Stenosis means narrowing. So in the heart valve, there narrowing occur in the heart valve, that is mitral stenosis, pulmonary stenosis, aortic stenosis. In addition to that, there is another classification, that is coarctation of aorta. The coarctation means also narrowing of the lumen of the aorta. Here the picture of the stenosis, here we know this one is the ascending aorta, and in the valve of the aorta this is become narrow, so this is aortic stenosis. And here we can say on the left side, in between here the mitral valve present, and the mitral valve is become narrow. Okay, so this one is the mitral stenosis. In healthy mitral valve, it this looks like this, and when it is stenosed, it looks like this. And there is another classification. Here we can see, from the right ventricle the pulmonary trunk arise, and here the pulmonary valve is stenosed, so this one is the pulmonary stenosis. And the last one is the coarctation of aorta. Here we can see the arch of aorta, and this one is the brachiocephalic trunk, this one left common carotid, and this one is the left subclavian. So if there is any narrowing beneath the origin of the left subclavian artery, this is known as coarctation. Okay, and this coarctation is associated with patent ductus arteriosus. So if the narrowing occur before the ductus arteriosus, this is known as the preductal coarctation, and if the narrowing of the aorta is occur after the ductus arteriosus, this is known as the postductal coarctation. Now the cyanotic cardiac defect, and here the shunt occur from the right to left. Okay, and we know in the right side of the heart, in there is deoxygenated blood, and which comes from the superior vena cava and the inferior vena cava, and in due to okay. Now come to the classification of the cyanotic cardiac defect, and they are classified into transposition of the great vessel, tricuspid and pulmonary atresia, tetralogy of Fallot's, and Epstein anomaly. Now have a look here. This one. We know the aorta ascent from the left ventricle and pulmonary trunk ascent from the right ventricle. What happened here? Why they are situated side to side? Because we know in the truncus arteriosus, in the developing heart tube, there is formation of a spiral septum. If the spiral septum failed to develop, and it developed as a vertical septum, that in the right side of the truncus arteriosus the aorta will develop, and on the left side the pulmonary artery or trunk will develop. So from the right side the aorta collect deoxygenated blood, and that will circulate throughout the body, so the color will be blue and baby becomes cyanosed. And in the from the left side the pulmonary trunk will collect oxygenated blood. So this is known as transposition, that means side to side position of the great vessel. Now the atresia. We have to know the meaning of atresia. Atresia means complete obliteration. This one in the right atrium and in between the right ventricle there is the tricuspid valve. If the tricuspid valve completely obliterated, this is known as tricuspid atresia. As it is completely closed, the blood from the right atrium cannot goes into the right ventricle. As a result, right ventricle becomes smaller due to lack of nutrition and increased pressure within the right atrium because the blood is accumulated here. As a result, the blood from the right atrium, deoxygenated blood from right atrium goes to the left atrium and then left atrium to left ventricle, and that circulate throughout the body. That deoxygenated blood circulate throughout the body, so the baby becomes cyanosed. The next one is pulmonary atresia. Here we can see the pulmonary trunk lower end is completely closed or underdeveloped. Okay, this is known as pulmonary atresia. And the same thing, the blood cannot drain from the right ventricle. So there is more pressure on the right side, and as a result, the blood from the right side goes into the left side. That deoxygenated blood circulate throughout the body. Now next problem is tetralogy of Fallot. We'll discuss it next video. And the last one is Epstein anomaly. Epstein anomaly, we know in the tricuspid valve there is anterior, posterior and septal valve. And if the anterior cups of the tricuspid valve is larger, and there may be the blood is backflow to the right ventricle or to the right atrium. This is known as tricuspid regurgitation. As a result, the more blood accumulate within the right atrium and the right atrium become enlarged. Okay, and that blood goes from the right atrium to the left atrium through the foramen ovale. Okay, and this condition, this combined condition is known as the Epstein anomaly. That's all about the congenital heart disease. Thank you for your patience hearing.